specializing in a trauma-informed approach through a systemic and intersectional lens. Currently involved in private practice, she has previously worked with helplines and post-litigation centers in Mumbai, engaging with clients from diverse socioeconomic backgrounds. She believes in the autonomy that clients have over their lives and views therapy as influenced by political and social factors, recognizing the impact of marginalization. Her research is titled, Are We Next? Changing Cultural Landscapes and Its Mental Health Impact on Indian Christians. Lastly, we have Aiman Haque, who goes by the pronouns she, her. Aiman is a researcher whose prior work has largely revolved around the lives and livelihoods of women in the informal economy. She also has considerable experience working with feminist collectives and organizations. Their research is titled, The Negative Consequences for Mental Health of the Visibly Muslim Woman, Muslim Indian woman. So without spending more time, since we're already starting a bit late, I will directly get to the questions. We will start with Dr. Ganie first. Dr. Ganie, my question for you would be, could you discuss the key findings from your study on disenfranchised grief and the grieving rituals and processes observed during COVID-19 pandemic? And with that, because the context is of Kashmir, additionally, how do the grieving experiences during the pandemic lockdown compare with those arising from prolonged periods of disruption and uncertainty in regions like Kashmir?
So good morning, everyone. Thank you for the kind introduction. And the opportunity also to discuss our findings, our study on disenfranchised grief and grieving rituals which were observed during COVID-19 pandemic in Kashmir. So this is basically findings from a study, independent study that we did last year, following the qualitative approach, phenomenological approach. So we interviewed 10 participants from different districts of Kashmir to get to know how the COVID-19 pandemic has disrupted their mourning and altered their grieving rituals. So the question here is to specifically discuss some key findings from the study. So we have done the thematic analysis and we just derived 4 major themes out of it. So I'll be presenting some findings out of those 4 major themes. So if in case like later on anyone wants to know more about it, so I'll be happy to answer your questions. Plus, I'll be discussing also its connection with the prolonged uncertainty that the Kashmir has faced due to the conflict. So I'll make a connection here, how this is much relevant with our population. So coming to the first theme that we found was about the disruption of traditional and religious mourning practices due to COVID-19 pandemic. So there are basically 6 rituals that are followed in Islamic tradition for the deceased at the time of death, during washing, shrouding, carrying the coffin, during the burial and after the burial. So participants here, what we found, reported inability to carry out these essential rituals such as performing the funeral prayer, what we call the janaza, Quran Khani or Fateh Khani, which is the recitation of Holy Quran after the 4th day of the death. Plus, when the death is imminent among the Muslims, so we give the holy water, which we call Zamzam. You might be knowing about that. So along with that, we read some verses from the Quran. So during COVID-19 pandemic, the participants are those who lost their loved ones in Kashmir were unable to follow these rituals. So which are very close to them and very basic, fundamental in the Islamic religion. So I can give you some of the examples like what participants reported, like it's very hard for them to see that the janaza was performed only by 12 to 14 people, mostly by medical staff and some community volunteers. So even though they were fit, like they could have participated in the janaza, but they could not. They were seeing from a distance. So you can see the impact like it might have created on them. Coming to the second theme, which talks about the participants dealing with a conflict between faith and the practical constraints during the COVID-19 pandemic. So many participants and family members who had come in contact with the deceased had to quarantine themselves, which led to the alienated grief among them. So the practical constraints during the COVID-19 pandemic resulted in family members following the substitute rituals. So we also found the emergence of alternative rituals in Kashmir, such as the participants, they reported like giving janaza, niyaz or charity to the Darul Ulooms, which are not basically done during the time of death, but COVID-19 actually made them to do that. Our third theme basically talk about the emotional experiences of participants due to de-ritualization. So participants reported they were in the web of overwhelming emotions. For example, the depressive symptoms, guilt, sorrow, and emotional anguish. So that we also identified participants reporting on. Our fourth theme was about the social judgments. So not only about the basic issues the family members face, but they also faced about the social judgments and the social stigmatization, which also compounded their distress. So some of the participants reported they have been blamed actually for spreading the virus within the communities. So I can read out one phrase that people call them virus ghar, which means virus families. And some of the assumptions, for example, what participants reported that people used to give some social judgments, pass some comments like the Muatas Kuruksal, which means they invited the death, which actually made the deceased scapegoat. So these were some of the challenges and experiences that we came across during our study. So the second question that connecting the grieving experiences during COVID-19 pandemic with that of conflict in Kashmir. So it has some parallels. So while deaths during COVID-19 and those arising out of conflict in Kashmir has some similarities in terms of abruptness, uncertainty, and emotional anguish, whereas the deaths during the conflict in Kashmir predominantly instilled fear. It instilled the anxiety among the participants, the people in Kashmir. So in both cases, participants reported the overwhelming emotions. They could not control their emotions, their feelings about not participating in the grieving rituals. Yeah, thank you.
Thank you. I'm so sorry. And I'm sure that there's much more to say, and this is such an important study, but given the time constraint, and I hope people will also reach out to Dr. Ganie during the break to hear more about what has been done. So sorry, Leema, if you could just elaborate on the need for a study such as this that you've done, along with the significant preliminary findings of your study.
Yeah, thank you so much, Sabah. So the two parts to this question. One is the context, the significance of such a study. I think we are not aliens to what is happening on social media, I guess, about the blatant hate that's going on about the for minority communities, especially Muslims. And if we go population wise, I know Christians come third in terms of the density of the population. So I think the need to conceptualize such a study again came from two parts. One, my personal identity as a Christian, as a Malayali Christian in Mumbai, and a sense of curiosity, and also as a therapist that I see in my therapeutic relationships that I share with my clients. So that is where I could sense the threat, the sense of dread, the sense of safety being compromised, which is why I thought to embark on this research study. And what some of the preliminary findings I found was a lot of hesitation. We explored in the cast panel when we talked about that. Clients are not able to bring up caste in their therapeutic spaces, and I thought religion also plays this somewhat of the same role, because when they were talking about like my participants especially were talking about it, there was a lot of they're telling me that it's not like towards everyone, huh? Like there are good people as well, we are not generalizing, or it's like it's as if they are asking me that, like telling me that it's just a school, right? Like they're just running a school, so why the discrimination? Or it's just an apartment, or like a particular participant talked about how church spaces or church grounds are being legal cases are being fought against them. So he was like, but that's just a ground, right? Like we're just using it for gatherings, as if to legitimize their struggles. And I think somewhere I was like, as a therapist, we mirror, right? So I think my struggle was being legitimized, because the first question that, again, when somebody asks is like, oh, has it happened to you? I'm like, no, and I don't know the answer to that. And secondly, what I also, and the hesitation, again, to bring upon that, one participant talked about how when she was in college, she would see conversations happening among classmates about Muslims. And she told me that she wouldn't, put any opinion at all, because she's like, then attention would be drawn to me as a Christian. And me being a minority, again, like that scrutiny would be there. Same thing, a lot of participants said that if anything happens, I don't want to say anything to provoke or trigger anybody else. I will just walk away from there, keeping my peace. So that was one. Second was a sense of anger. A lot, so a particular participant talked about how her son, like she said that her son was mischievous and kharab kar diya rangoli, and uske wajah se there was a lot of backlash from the neighbor. The neighbor was angry. There were a lot of threats, to the point that she told me that she had to go to politicians. She fears walking out in the street, because that's the level of threat that she experienced. And that's, again, she's like, Leema, it's just a rangoli, right? And I was, and there's a lot of, so if I ask them in detail, they don't want to talk about it. And again, because I know the kind of, she was also the one, after I paused the interview, she was like, Leema, are you like, would anything happen to you because you're doing this? And I'm like, yeah, I don't know, perhaps, but hopefully not. So that's something that I saw. Also a sense of ambiguity. So previous researchers have also talked about how when discrimination is overt and explicit, it of course that's harmful. But when the discrimination is subtle, what happens is that for the people who are experiencing it, there's a lot of cognitive demand. You're appraising whether is this discrimination or is this like a personal thing, that like an inhibition. Something that I could see that a sense of ambiguity there as well. And one particular participant said, wherein his Hindu friend was like, they had gone to visit somewhere, and he was like, don't pretend to be a Christian, pretend to be a Hindu. So there's also that ambiguity there, right? Like, can I trust? He's my friend, but can I trust them? And he also talked about, oh, nahi hota rehta hai, but it's just fun banter. So these are some of the findings that I got through the study. Yeah, thank you.
Thank you so much for that, Leema. And yes, there are so many parallels that one can draw with the Muslim community when you, so it's such an important paper that you've done. Aiman, moving on to you and the paper that you've done, how are visibly Muslim women navigating the conflicting onslaught from both right-wing forces and progressive ideologies regarding the concepts of womanhood and modern identity?
Thank you, Sabah. So, of course, there's a lot to be said and has been written in media, mainstream media as well, about how visibly, and by visibly Muslim women, I basically mean any Muslim woman who wears a hijab or has any kind of markers on her that give her identity away. So there has been a lot of discourse, both negative and positive, about how women have been reacting, and sometimes the women, not just women, even children actually, with the whole Karnataka hijab ban in the schools, being cornered to react in ways that probably they would not have. They would have just gone about their lives. So they've protested, they've written about their experiences. There's a lot to be said about that, but since we just have 5 minutes, I would also like to talk about the reaction or the discourse that has been there around this whole idea of Muslim women wearing the hijab and their agency. So both, I mean, there's nothing to be said about the negative aspects of it, because that clearly comes from a place of malice, because the intent is to corner them and to not give them their rights and the spaces that they deserve. But even the positive stories in media, in the mainstream, focus a lot on questions like, does the woman have agency? If she is wearing a hijab, let me go and talk to her and ask about all the ways that she actually has agency, even though she's wearing a hijab, and like to write and prove that her family is not oppressing her, or her, I don't know, she is wearing it out of choice, and then dissecting whether how much of that is choice and how much of it is brainwashing. And according to me, these questions really do not matter in a society where freedom across for all women, but especially for women from marginalized communities, is so restricted. I mean, we've been talking since yesterday about how our systems are built to oppress, especially if you're from marginalized caste, gender, religion, identities. And I think even like in the positive stories or any discourse that happens around it, in the mainstream, I'm saying, because a lot of these conversations that I am talking about, a lot of the writing, the women in the community are already doing. We are having these conversations, but they're not in the mainstream because there's no space for it. So the mainstream should be talking about how systematically the government and other spaces should be creating opportunities for expanding agency for everyone, and particularly for people from marginalized communities who struggle a little more. So I am a Muslim woman, and according to the discourse that has been happening, what should happen is, because I don't wear a hijab, I should feel extremely empowered. And like, I don't have that piece of clothing, so everything's perfect, right? But I don't, because I know that I'll still face discrimination in the job market. And this I'm not saying out of thin air. You can just Google it and you'll see. Even recent studies have proven that Muslim women face a clear discrimination when it comes to the job market. I should feel secure living anywhere, but I won't get housing in any area that I want, even if I can afford it. It's not just about the money. I mean, keeping aside the fact that a lot of marginalized communities do not have the economic sort of resources to even afford to be in these spaces. But even if I do, I'm from Delhi and I have faced this problem. So I know that whether I wear the hijab or not, my name is going to be a problem. If I'm a single Muslim woman, if I go on these dating apps, I should not be fetishized. All of these apps that have, these incidents around the bully buy apps, and I don't even like talking about that, because like, what is that? And someone is telling me that if I don't wear the hijab, all of these problems are going to magically disappear. The whole thought and writing around this sort of a thing has to change, because otherwise the nitpicking around how much that piece of cloth matters. It doesn't matter if otherwise society was perfect, then maybe there was a space for having these conversations around, how much of it is my personal agency, how much it is like influence from the family, etc., etc. But we're not there. We're not there. To reach there, there's like 100 different steps that have to be covered, which have not been covered yet. So yeah, that's what I have to say.
Thank you, Aiman. And as a feminist myself and someone who's also critiqued the hijab, it is challenging. I think we've been put in this very difficult situation of having to, support the choice of the hijab. and you know how it is now. So moving on, thank you so much for everything that you shared. Now we move to round two, and I'll again start with Dr. Aasim. How do the themes of disenfranchised grief and grieving rituals connect to mental health on a broader level? If you could help us understand that.
So disenfranchised grief and grieving rituals have a profound impact on mental health because they interfere with our normal grieving experiences as well as emotional healing. So disenfranchised grief usually occurs when the loss is not actually validated or supported by the society, which in turn leads to emotional distress and prolonged or complicated grief complications. So this was particularly evident during the COVID-19 when the restrictions on funeral prayers, religious ceremonies, as well as the communal support left many without the traditional means of mourning. So it's evident that grieving rituals are very important in terms of social connection and emotional healing. So because they structure, they provide this structure, comfort, sense of belonging, helping individuals to process their grief in a culturally meaningful way. So, but when these grieving rituals are actually disrupted, so individuals may develop the issues of sorrow, guilt, emotional anguish, which in turn increases the vulnerability of certain emotional disorders. For example, the anxiety and depression related disorders, and increases the vulnerability of suicidal ideation, particularly among those who have witnessed multiple losses within their families, as in the case of Kashmir. So we have a population of 10 million where 1 million is suffering from depressive symptoms. So you can see the emotional or the mental health burden prevalent in the Kashmir from mental health professional perspective or any healthcare perspective. So it's very evident there. So there is no question that during COVID-19, it had profound impacts on mental health, and it had several consequences, particularly because of the survival guilt, the social isolation, the bereavement overload that it created. So many individuals felt deep guilt actually for not being able to care for or to prevent the death of their loved ones. The absence of the end of life care or the rushed funerals actually disrupted their traditional mourning practices. So many individuals also reported that they could not find the closure due to the absence of customary rituals which are being followed for decades over there. In addition to that, the trauma of witnessing the distressing hospital scenes, making tough medical related decisions, losing caregivers during the time of COVID-19, or in the case of conflict in Kashmir, heightened the chances of or the vulnerabilities of PTSD related symptoms in Kashmir. It caused the emotional and moral injury as well as economic uncertainty. So there have been reports also by different research based organizations that nearly 45% of youths in Kashmir they suffer from traumatic symptoms, post-traumatic symptoms, because they have been exposed to multiple or repeated events of trauma, leading to complex traumatic experiences within youths in Kashmir. So in connection to the connection on a broader level, the connection between the disenfranchised grief, grieving rituals, and mental health, and they need an comprehensive integrated approach that includes every aspect, for example, the spiritual, social, cultural, religious aspects, in order to increase the social well-being or the emotional well-being of individuals and to reduce their vulnerability to various manifestations pertaining to mental health disorders. Yeah, thank you.
Thank you for that. Yes, that's an important thought for everyone to leave with also, that really what we really need is is this love, this compassion, this kindness, sense of belonging, which is being taken away through this obnoxious act. But thank you for that. And moving on to Leema. Leema, how do you see the link between discrimination and the distress at being targeted, and in the context of mental health? And also, how should mental health professionals respond to this?
Yeah, so while I was thinking about it, I was just, what has been coming up is, one is religious literacy, and I'm going to tie both those aspects together, how discrimination affects. So when we talk about religious literacy, when I was in undergrad, we had this counseling book which had one chapter on multiculturalism. And and of course it was a book that was published abroad. I read the word Caucasian in it and I had no understanding of what it meant. And when but because I have a background in sociology, like caste and the Varna system, everything was talked about, but there was no connection between the sociology and psychology perspective. So I think one is building religious literacy. And again, why I emphasize that is because when I talk about religious denominations, when I tell people that, the first thing people will be like, denomination, वो तो पैसे में होता है ना? नहीं, पैसे में नहीं होता है. There are under Christianity, there are different denominations that a person may belong to, and each can be a minority within the religion itself. So that is something that. And therefore, one participant did say that she has to continue explaining to people who she is, which religion she belongs to. And then there's that comment, you all have come from outside, like, or aren't all Christians from Goa? And she's like, no, I am from Kerala, and we come from there as well. And studies abroad have talked about immigrant status, and there when the discrimination is happening, it's more like, oh, you all have come from a different country. And that's what she was saying. She's like, this is our country, where do we go? And like how they talked about the foreigner status as well. So that is one, building the religious literacy as mental health professionals. Second, I also the grounding techniques that we talk about whenever some clients come up with anxiety or any kind of regulation techniques, we always talk about the 5, 4, 3, 2, 1 or any other techniques. But all of the participants I spoke to talked about how faith helps them. Like it's like they use the words meditation, it's calming, it's relaxing, it gives me a sense of peace, like my thoughts are not as cluttered. So when I feel like, when will we address that as well? Like, none of the relaxation, the regulation techniques talk about faith as an element. So can we incorporate chants or hymns or prayers, any religion, and can we incorporate that? And lastly, when I was reading literature, there was this word that came up, and in context of the Sweden government, and they use the word ombudsman. Okay, so I was like, what is this word? I don't know. And I was like, कि शायद Swedish word होगा. But नहीं, English word है, and it's actually a noun wherein there is like redressal systems which are independent of the government and also have a certain degree of independence to cater to the complaints that are received. And I was thinking, because we are in an educational setup as well, I was like, it would be interesting to have perhaps redressal systems that are independent of perhaps the counseling department as well, right? Like, because people have a lot of stigma with regard to mental health. So that's what I would like to bring about. Yeah. Thank you.
Thank you. A great suggestion, Leema. Okay, Aiman, since you've been talking about agency, can you just elaborate about the connections between agency and mental health in your study?
Right. Yeah. So, I mean, there's obviously a positive correlation between agency and mental health. In the context of conversation around, I mean, we've been having conversation since yesterday about communities, and the overarching theme is that to have sound mental health, you need to have agency, which is also linked to like dignity, control over your life, having access to resources which can allow you to build your life. I would like to also focus on how I think this agency or this idea of agency, how it's linked to also having an inner life, not just as an individual, but as a community. So who is allowed to have an inner life is also a question, and I think it's relevant in both politics and mental health. Muslims in general, again, talking about mainstream discourse in academia, in development sector, conferences like these, state, I'm not going into the state because, I mean, I don't know. I mean, right now it feels like a lost cause, but these spaces still have hope. So the kind of conversation around agency and what constitute agency has to change. This obsession and focus on Muslim women's clothing and not just Muslim women, even Muslim men, and how they present themselves, like, wo bahar ka hai. There's a lot of things that go inside, and this obsession with are they Muslim enough? Are they medium Muslim? Are they too Muslim? Like, it's irrelevant. So if there is an acknowledgement that there is an inner life of the community and of the people in it, then the discourse will also change around how to support that inner life, how to support those aspirations, how to make spaces safe, how to increase employment, how to make housing accessible, all of that. And that then would also, I mean, in the mental health space, one very specific, I think, around this sort of thing that I think would help is this concept of intergenerational trauma has been coming up since yesterday in a lot of contexts, and I feel like there should be more studies around how intergenerational trauma manifests in Muslim communities, and Muslim communities, again, are not homogeneous. So just as an aside, I was actually really happy that my abstract got selected in this conference, because I saw the diversity of the conversations. And even in today's panel, I mean, we have a Bengali Muslim person, and I've also been all over. I mean, I grew up in Calcutta, I'm from Bihar, I've lived in Delhi. So I know that Muslim communities and their inner life, as I'm calling it, is very different. They have their own regional struggles, and there are caste differences as well. And they have their regional struggles, then there's the national thing going on. So unless there are very specific studies in how, in terms of how intergenerational trauma manifests in these communities, they'll always, I mean, we'll always be boxed, we'll always, our responses to things will always be scrutinized through a predetermined lens. And to like explain more through an example of what I'm saying, so I have family in Ahmedabad as well, and we know the history of that city. There's a lot of shame, and there's a lot of shame that the Muslim community, and a lot of sense of unsafety that the community carries as well, even after, like, long after whatever happened did happen. So I'll just give an example of a choice around education that because I've been around these conversations, and I really want to showcase how sometimes trauma like builds and manifests and just influences our day-to-day choices. The choicing around school, especially for girls, is made not on the basis of whether the school is good or whether any of the factors. Before that, the primary thing is it nearby to our very ghettoized area? If there was violence, if like there was a bout of violence that were to break out, will we be able to reach there in time to get our children, to get our girls back? So if I talk about an intervention, if someone were like, oh yeah, I mean, I believe in education for Muslim women, for Muslim communities, and I'll build a school in this place, and people from the community do not turn up, that's not like, okay, the Muslim community does not value education. No, there is like a lot of internal conflict that is going on around that decision. So unless studies like this are done and the root of the problem is recognized, only then can these can our communities be helped in the way that we need. Otherwise, you can do interventions because they are to be done, but they will fail, and the onus will be put on the community, wrongly so, and there'll never be any changes anywhere. So, yeah.
Thank you for that. I think these were really difficult presentations, also because they're so personal and yeah. I feel discomfort is good, and I'm hoping that there's been a lot of discomfort created through these presentations amongst the audience, because discomfort is what propels us to change, right? To act on it, because we don't want to stay there forever, or meaning even for a short period of time. So, so thank you for those really insightful and discomforting presentations that you have made. We now open up to questions.
What I want to ask Dr. Aasim is, because the landscape of Kashmir is so complex, and because grief has been such an integral part, of Kashmiris because of occupation, was there anything different that you observed that complicated their grieving process? Because their relationship with grief is so complex. Did it make it more complex for them in the context of COVID, or was there anything associated with resilience or coping that you identified was different? My second question is to Naseema. The MHPS's activities that you described were mainly non-verbal, especially when you said that these people don't even have the vocabulary for mental health. So in a scenario like that, on what basis did you decide that these are going to be the MHPS's activities that we are going to use? Because I read the abstract and it said there was play therapy, if I'm not mistaken. That was also one of the things that was implemented. So on what basis was the community helping you decide what kind of expressive or non-verbal therapies that we are looking at? And my last question is to Aiman. In the secondary literature that you reviewed, a lot of literature, as I was reading when this was happening in the past 2 years, we're also focused on a lot of dominant discourse. And when I mean dominant discourse, the dominant discourse for Indian Muslim women is also about hijab. As you can see, I'm not a hijabi woman, but I am a practicing Muslim. So did you find any literature that was talking to you with regards to what it's like for Muslims who are not practicing hijab, for them to see that there is an uproar and outroar by the Muslim communities wanting to protect women who want to have the right to wear hijab, versus where is that Muslim community supporting women who don't want to practice hijab? So was there anything that you found that was reflecting on this? And I will stop now.
I'm not sure if you have really worked on ground with this aspect of it, but I was hoping to sort of understand the mental health concerns within people who are now left stateless. So now, once the decision by the Foreigners Tribunal and everything has been made, and people are officially stateless, and given the alarming ambiguity in India with refugee rights in general, so basically my curiosity is about who takes responsibility for these people, who is supporting them. Is there, we know what's happening with the Indian government, of course, but is there any intervention from international courts? Our case is going to international courts. So basically, yeah, around that, if you could address anything. Thank you.
So what I wanted to know is when you work with a marginalized community and one that is also very oppressed, and you work so much on building resilience within them, when the system outside or the government outside or has structurally continues to oppress them, and that's precisely why we are here talking about it, right? So when there is so much of, there's no change outside, but resilience need to be built from within the community, how challenging it is when the outside is getting worse, but you need to keep building resilience to maybe cope with it better. And it is also sad that the onus is on the community itself to sort of feel better or get better, when the system itself only makes it, pushes them further down the spiral, right? So how challenging is it, and what does resilience like that, what does such a resilience look like, and what can it do? What can it do when it is born within the community with the help of community and allies and a support system? What can such a resistance do to change the lives of the community, the oppressed community itself, while the world outside or the state outside continues to oppress them? What is the potential that lies in building such a resilience?
Christians in Mumbai. So I wanted to ask you about the erasure of caste, because it happens on two levels, because there's this idea that caste does not exist in Christianity. There's also the idea that caste does not exist in the city. So I wanted to ask if caste came up among your participants and what it looked like and about the mental health impact.
Thank you for the question. So the question was actually like, what's that thing that makes the grief so complicated in Kashmir with reference to COVID-19 or the conflict that's going there for decades. So we know that like the region of Kashmir is in many aspects not same like as the other parts of this country. So we have been going through the conflict for decades, and there is a lot of like emotional and like mental health burden actually that's very much prevalent in Kashmir. The changes are not through the secularization or the globalization, but it's the region's history of the conflict, the displacement, the socio-political instability that's existing very much there. So the complications with reference to the grief do actually emerge from these factors. So there is much to do, with reference to mental health. And if you see Kashmir from north to south, which we are very much North Kashmir to South Kashmir, I mean to say, we are very much similar. Like our culture is same, our food habits, everything is same. So anything that intrudes that identity actually creates some disturbances, be it with their culture, their traditional patterns, or in that case the grieving rituals also. So the acceptance is not that easy there in Kashmir with reference to the situations or the conditions like this. Yeah, I hope I answered your question.
Thank you for that question about caste. Honestly, it didn't come up in conversations because one, I would also like to emphasize that the sample was educated and almost most of the participants had completed post-graduation and working individuals coming from middle-class families. So caste as an issue, nobody talked about it. But I have heard of caste coming up in Christianity in Kerala. I've heard about it in conversations. But I think that would be a further scope to study. But I really like that perspective. So thank you. But it didn't come up in my study. Yeah.
If I understood the question correctly, I think it was about finding literature on practicing Muslims, but those who are not carrying markers, I think, like the hijab or something. I was not particularly looking for that kind of literature, but I think it's also not there. In the past, I've tried to find stuff around that because my own experience is like that. It's not obvious that I'm a Muslim person. So yeah, there's definitely literature lacking on there, whether it's academic or news articles or whatever. From personal experience, I can tell, and also experiences of women around me, that it's easier to slip under the radar if you're not wearing a hijab. It's more, your acceptability goes up, especially in certain kind of spaces. But there's also some struggle around a sense of belonging and basically questions around what is it then, which spaces for me, which people should I go to, etc. It's like a complicated sort of finding your own space sort of a thing. So yeah, I hope there is more literature in the future around this as well. Although I don't think, I don't think it's as important as some of the other more structural issues that are there that have to be fixed.
Thank you for that. I'm trying to think of how to wrap this up because, though it's a panel on majoritarianism and counter narratives to majoritarianism, here we have so many different set of issues, and meaning because I probably had to limit the panel to just 4 or 5 speakers. I'm sure that there are so many more issues around religion and living the life of a minority in this country that need to be talked about, because as of now we just seem to be concerned with the hijab as if that is the only concern that the Muslim has today. So thank you Aiman, for that paper that you've done. I think it's also very nuanced. It's not simply a black and white that the hijab is good or bad or whatever else. So coming to the question of literature, I think there's this fantastic book by Ghazala Wahab, Born a Muslim, which I urge you to read. It's a brilliant book on living the life of a Muslim. Just read it. It's good. So to wrap this up, I would think that starting from the plenary, the discussions that have been happening and what this panel has also reiterated in some ways is that the issues that we have here are structural, and yet the expectation is, and I think as Sharanya has also spoken, is that it's left to the individual and to the communities to deal with these issues and to come up with the counter narratives to these issues when the problem is out there. The other thing I think is that each one of us here, though we were talking about being Christian and Muslim, we each inhabit so many different identities that it's really difficult to compartmentalize and say that it is only this identity under attack. So when Leema says that that there are denominations and you can be a minority within a minority, I think that's true for many of us sitting in this room here, that that there's so much, and if we're able to reflect on that, and that kind of empathy will help us move forward and also try to understand the other. Coming to the panel, I would like to thank Dr. Ganie because just bringing to our consciousness disenfranchised grief, meaning not just the implications on mental health, but the fact that it exists, that there is something like disenfranchised grief that an entire population has to go through because of their location, right? And also yesterday, Grishma in her presentation mentioned disenfranchised grief. And I think, so when I say that these multiple identities, also the intersectionality that becomes possible is that if I understand my disenfranchised grief, will I be able to understand the disenfranchised grief of another community which has been similarly demonized, criminalized, and been under so much surveillance, right? And so can we make those connections between us to say that I understand you and reach out to them, rather than because we know that there are Muslims who understand their oppression but can be terribly homophobic, and so also Dalits who can be and Muslims can be casteist, and Dalits can be homophobic and Islamophobic. So we have it all. So how are we going to be able to use this to broaden our understanding, and also I think this is also helping us understand the levels of stress that people are going through because of the identities that they're bringing. So thank you for that. As regards the NRC, the Citizenship Amendment Act that came in, in 2019, there's this report in The Wire which says that post the act, the first phase, there were 19 million people who were considered disenfranchised, right, who were put into detention centers. Of those 19 lakh people, just 4.8 were Muslim. Yeah, so that is 26%. Yeah, just 26% of those were Muslim. And this NRC and the CAA were the whole plans to get the majority to vote for the government. And it was 74%, the majority, who were in detention centers, thanks for the vote, right? So how do we understand this? And I think these are also questions that we should take back with us and educate others about, that, that it might be that, you use a community to further an agenda of your whatever political whatever, and this is what you get out of it. So yes, and I think what's really important today is that bringing in how we understand reaching out to people who are experiencing distress in situations such as this. And you're right, you can't have a room and, have a counselor sitting in front of you and helping you through your, your grief or, your distress, because these are not the everyday situations. And how will mental health professionals respond to situations such as this is something that I hope you will all begin to think through and will be one of the takeaways from this panel here today. What Leema has been talking about, and I think that it's meaning that amongst activists, and I'm here as an activist, so I'm not talking too much mental health. It's more activism that is speaking here. Is that that instead of building solidarities amongst people who are marginalized because of their identities, we are actually bringing each other down. And so these attacks, that the paper that Leema brings, is really important for us to make those connections between minorities, to say that we are not different, that here, meaning these are identities which will come in. So I would think that, it is each one of us sitting here, and I don't think, people here would need that much education, but we have to take these outside of this room. So what MHI has done is really, really important. The conversations that we've had are extremely important, but they cannot stay limited to us. And they have to go out. They have to go out to our WhatsApp uncles and our buas, and please take them there, because they are the ones who need to listen to all of this, right? And as I think Naseema said very beautifully, that we are all meant to love. That's the natural feeling that you're born with, meaning, that there's a longing to belong. How can we further that? How do we reach out to that aspect of people rather than, reaching out to, the hate? So let's talk, let's start conversations from connections rather than disruptions. And then let us connect, because we are all, each one in this room, responsible for the environment that we are in today. So if we are not furthering or strengthening that environment, then sometimes we are responsible for the maintenance of that status quo. And maybe, it's time that we stop being the maintenance people and began to shake it up a bit, right? So yes, thank you for being this wonderful audience, and thank you for these wonderful presentations. Faisal started with this fantastic shairi, and oftentimes, it is expected of Muslims that they will have a shairi. So the two things, so people meet Muslims and the first thing they ask is, biryani kab khilaogi? And dusra is, stage par hai to shairi kab sunaogi? Now, I am terrible at both. So not the ideal Muslim, I'm sorry, but I think I was actually thinking, last night I spent some substantial amount of time, in spite of the wine and everything, what should be that shairi that I should end with, but none came to mind. But I thought, meaning given the context of this conference, it's Martin Niemöller's poem that came to mind, that, that we should remember and remind ourselves, actually, because I hope you all have heard it. If not, please Google it. But yes, so, there will be a day when they will come for you, and when they come for you, we really need to have all of us standing for the you, right? So thank you so much, and thank you to MHI for this wonderful panel.